Zusanhuo means the foot or the leg, 3 fires. Okay. This is comprised of Huolian. Huolian is, I'll give you the numbers. I have to tell you, I've had to look up the numbers myself because I don't usually think of the numbers in Tung's acupuncture. Because we'll talk about in October, the numbering system is kind of weird, if you can figure that already. So, sorry, that's supposed to be Huolian. So the word Huo means fire. The next one is called Huoju. This is 66.11. And the third point is called Huo San. This is 66.12. And we're going to discuss what these points do, where they're located, etc. So the word Huo means fire. It gives you an idea that Master Dong thought of these points as being able to treat some sort of heat, fire, something of that sort, right? So we have naming conventions in Dong's acupuncture that oftentimes relate to 5 phases. So you'll see the 5 phases listed frequently, like we do in conventional acupuncture, in point names. Lian means lotus. So the same lian is in like Huang Lian. So herbs like Huang Lian have a heat clearing effect. The word Qu is the same as chrysanthemum. So again, this image of like heat clearing. And San means powder or scatter, right? So literally it's the fire lotus, fire chrysanthemum, and scatter fire. Those are the names of the points. These points, I'm going to bring up the diagram so you can take a look at them. So these points, this is taken from the 6th edition of the Practical Atlas, which is the book that I wrote with Dr. Ross on Dong's acupuncture. So we can see here 66.10, 66.11, and 66.12, right? So these points are very close to or overlapping, and I believe that they overlap. There's some people in the Dong's world that believe they're slightly different, and I'm going to tell you that I simply don't believe that. If the point is, too fun, like 0.2 sun away from another point, it's the same damn point in my book. So these points are overlapping Tai Bai, spleen 3, Gong Sun, spleen 4, and Rangu, kidney 2. Right? So we're basically needling the point combination of spleen 3, spleen 4, and kidney 2, which illustrates another needle strategy that's really, really vital to Dong's acupuncture, which is the Daoma needling. So Daoma needling is a combination of 2 or 3 points, usually along a channel line. So here we're actually combining 2 channels in conventional acupuncture, spleen channel with kidney channel, but they're essentially in a straight line across a part of the body. Sometimes it can be along one channel line, sometimes it can cut across channel lines. They can also be in a small triangular pattern, but using a combination of 2 or 3 needles can basically accentuate the effect of those points. Let me give you an example. Let's say someone comes to your clinic with nausea. Conventional point example. So a point that we all use for nausea is something like pericardium 6. Well, if you open the books, open Deadman, open any other book on conventional acupuncture, pericardium 7 treats nausea, 6 treats nausea, 5 treats nausea, even 4 treats nausea, right? Nausea is listed for all these points. So let's say you put pericardium 6 in, the patient feels a little better, but not quite as good as they might want to feel. There's no reason you can't combine pericardium 6 and 7 or 5, 6, and 7 as a small cluster of needles to further accentuate the effect in treating that symptom. Get the idea? So what we're seeing here are 3 points in a row that will all have the ability to treat this sort of uprising of heat or fire in the body. So we're using the 3 of them together to get a better effect. Now, sometimes with this case, I used all 3 of these points together. Sometimes we just used 1 or 2 of them based on palpation. Okay, so just so we have an idea of when I say palpation for an internal medicine case, sometimes we can do palpation based on pressure sensitivity. But for this case, what I'm doing is I'm feeling the pulse. And this is, if any of you practice Japanese acupuncture, this is taken from my training in Japanese acupuncture. We feel the pulse, and I'm feeling for that Sun position on the left wrist, which is where the heart fire is located. And then we're gently touching the points to see which one of those points will get that fullness in the heart position to even out and calm down a bit. So most often I would just needle all three of them together, and we would feel almost immediately that heart position sort of flatten out in a good way, right? Instead of being full and slippery, it would calm down and become more even with the rest of the pulse. Okay? Sometimes I would put 1 or 2 needles in, feel the pulse. It was a dramatic enough change. We don't have to do all three of them, right? So sometimes good enough is good enough. If you get the change you're looking for, you don't have to add more needles. So if we're looking at the list of indications, let me pull that up again. This is again from the atlas. We can see indications that can relate to, in particular, the top of the body. So we can see things like headache. We can see things like vision problems, dizziness, right? And then I'm going to suggest this is not dizziness for the most part from like, blood deficiency dizziness. This is a dizziness from something upstirring in the body. We can see distending sensation in the head. We can see hypertension is listed under Huoju, and it's not, hypertension can mean lots of different things. Let's assume it's hypertension from heat rising in the body of some sort, right? Palpitations, we see heart symptoms in particular. And if we look at the point functions, and I have a love-hate relationship with point functions that we can also discuss more in October, you can see here that in general, in Dong's acupuncture, these points are said to clear and drain heart fire, open the orifices, and awaken the brain. So it's used to treat this upstirring of fire, especially that affects the head. So in this case, we're using it for epilepsy because the location disease is this upstirring of yang, so there's cognitive potential, like loss of, when he's having clonic seizures, there's loss of consciousness, but there's also loss of sort of speech function and whatnot. That's located in the clear orifices of the head. Get that idea so far? All right? So that's the general sort of constellation of things we're seeing with this specific case and why these points will be effective. Now, let's take a little bit deeper dive into these points then. If we're looking at these points from a TCM perspective, again, we're looking at spleen 3, spleen 4, and kidney 2. Okay, so spleen 3, what point is spleen 3? What's a category of point? What's the phase association? That's what we have to do to understand what this point is doing to some extent. And even before we get there, let's look at, you think about that question for a second while I talk for another minute. Let's look at these location of these points. So we looked already at points that have a consolidating effect. These points are located on the foot, and one of the characteristics of Dong's acupuncture is the association of different parts of the body as microsystems. So one of the ways we can look at the foot, and I'll bring up this diagram. Let me just pull this up real quick. So most people, especially if you have any experience with something like balance method, which is based on principles taken from Dong's acupuncture, you may be familiar with this idea of limbs basically treating one another, but we can also map, and this comes from the atlas as well, we can map limbs to the trunk. So for example, we can see that the foot treats problems of the head. We see this in TCM all the time. Liver 3 can treat headaches. The hand can treat the head. Large intestine 4 can treat headaches. We can invert the orientation. So in Dong's acupuncture, Master Dong used large intestine 14 to treat dizziness, right? Problems of the head as well. So with the context of this case, the points spleen 3, spleen 4, kidney 2, and I'll just use the TCM numbering rather than the Dong names for now, All three of these points go to and can target the head. So if the location of the upstirring of yang is in the head, we can use points on hands or foot, and in this case we're using foot points, to treat conditions where the yang is going up too much to the head. Get the idea? So that's one way of looking at how points can be mapped to different areas of the body. And interestingly, if we look at points like spleen 3, spleen 4, and kidney 2, all of them in TCM treat indications related to the head. So for example, spleen 3 treats headache, pain in the forehead. Spleen 4, we can see treating insomnia. Spleen 4 specifically is listed for epilepsy. It also treats psychoemotional problems, facial swelling. These are all TCM indications of these points explained by this mapping of the foot to the head. Kidney 2 likewise treats state of mind. So kidney 2, for example, is related to, they say, fearful as if you're about to be apprehended. That's a traditional TCM indication for kidney 2. Protrusion of the tongue, right? This heat coming up. All these things are listed in the traditional indications for these points. All right, so back to my initial question. What point is spleen 3? Anyone? Type it into the chat room. What's the 5-phase association of spleen 3? What point category is it? So spleen 3, since we only have 10 minutes or so left, we can go over by a couple of minutes, I'm sorry. Spleen 3 is the shoe point and the earth point, right? So it's a shoestring point, and because of that, it's the earth point. So spleen 3 is earth on earth. Got it? What did we just say about earth's relationship to fire or heat? Right, so earth, fire is the mother, earth is the child. So for example, even in like, let's give an example of non-Dong's acupuncture. In something like Saam acupuncture or Japanese acupuncture, if we have heart fire, right? Let's say heart fire in Japanese, in Saam or Japanese acupuncture. Heart fire we treat by needling heart 7 or pericardium 7, because it's the earth point on the fire channel. And we combine that with spleen 3 because it's earth on earth. So spleen 3, in TCM, spleen 3 clears heat as well. And we see specific heat symptoms related to spleen 3 because of its association with earth, treating earth on earth. So in TCM, spleen 3 treats heat in the body, agitation, febrile disease, feverishness. This is all TCM indications. So not that different from Dong's acupuncture use of spleen 3. Now spleen 3 can treat other things as well because it's earth on earth. But in the context of this case, we're using it to drain the Tsun position of the left wrist. Got it? Spleen 4 doesn't have a 5-phase association. It's a Luo point. But let's have a moment of honesty. It's pretty darn close to spleen 3. So out of all the 5 phases that can be associated with, spleen 4 is closest to the earth point on the spleen channel. And likewise, spleen 4 has plenty of heart and heat indications. Kidney 2, what's the point category and 5-phase association with kidney 2? Think about that for a second. So now we're on the water channel. Kidney is the water channel. And 2 is the ing spring point, which means it's the fire point. So we know that kidney 2, even in TCM, treats all sorts of heat related to the kidney. So things like empty heat presentations, right? So the other thing we can remember is that when we're looking at channel connections, the kidney channel is the foot Shaoyin, the heart is the arm Shaoyin. So we can use kidney to treat heart as a channel substitution because the Shaoyin treats the Shaoyin. So if we have Shaoyin fire, heart fire, we can also use, for example, kidney 2 to bring that heart fire in under control. Especially in this case, because it's not a full heart fire, it's a heart fire because the kidney is not holding yang qi appropriately. So kidney 2 is like one of the points that helps re-regulate the relationship between heart and kidney, right? So in this case, we can do draining needle, but honestly, we don't have to do too much draining needle technique because all we're trying to do is get fire and water to communicate appropriately. So in his case, I don't really do any needle manipulation on these foot points. We let the channels work themselves. And in the context of this patient, human bodies naturally want homeostasis. So in many cases, if it's the right point with the right 5-phase association, we don't have to do really heavy-handed needle technique, right? So this is another discussion we can have some other time if you want to do another hour webinar at some point. I don't believe that De Qi is, you get the patient to feel, oh, it's sore and achy. And not only do I not believe it, I can give you Ling Shu quotes to prove that's not what it means, right? There's a description of what De Qi is in the Ling Shu, and nowhere in the Neijing does it say that De Qi is something the patient's supposed to feel. I'm not saying it's an invalid way of looking at it, but I'm saying it's not the way of looking at it from the Neijing perspective, right? A lot of it has to do with proper point selection, patient-doctor relationship, making the treatment space as ideal as possible. Nothing's perfect, but we want to try to get it as ideal as possible. So in this patient, these points are just inserted gently, really no needle technique, and immediately the pulse responds anyway. So we don't have to do needle technique. If the pulse really didn't respond, I could try to force it, but in this case, we don't have to force it. All right? So this is why, though, those points on the foot in Dong's acupuncture are used to treat problems of heat uprising. We're using points on the foot to treat the upper body. We're using the spleen 3 and spleen 4 because of the earth ability to clear and drain fire. Remember also the spleen channel has a direct connection to the heart. And kidney 2 re-regulates the relationship between heart and kidney, between fire and water, so as to effectively treat this condition of this heat uprising.